Well, developing now at 4:30, a luxury cruise ship hit by an outbreak of the deadly hantavirus is now heading to Spain.
There's been a lot of news about this ship. It had been stranded for days off the coast of Cape Verde with 140 people on board, including 17 Americans. Now, once they get back to the Canary Islands and are checked out by medical teams, they will eventually be heading home. The World Health Organization says the public health risk is low. Now, the virus can be deadly, but it does not spread like COVID or the flu. It typically requires prolonged, close contact with a person who is showing symptoms.
They're conducting a medical assessment of everyone on board and gathering information to assess their risk of infection. Our priorities are to ensure the affected patients receive care, that the remaining passengers on the ship are kept safe and treated with dignity, and to prevent any further spread of the virus.
So we wanted to talk to the experts about some of the questions that you had that we have too. What is the hantavirus and how common is it?
A lot of people want to know more about this. Charlie Wojciechowski talked to some experts today. So, Charlie, what'd you find out?
Well, guys, first of all, many of us heard of the hantavirus during the investigation into the Gene Hackman death. He and his wife were found in their New Mexico home. Betsy Arakawa Hackman had succumbed to the hantavirus pulmonary syndrome, a disease often associated with rodents in the desert. Now we're hearing about it on a cruise ship, and the situation is raising questions, so we went to a pair of experts for the answers. As the MV Hondias heads towards Spain's Canary Islands, questions swirl around how a deadly hantavirus outbreak occurred on board and the risk posed by the disease. Is this the next pandemic? We asked Dr. Michael Angarone, infectious disease specialist at Northwestern Medicine.
Don't think it is. We always have to be careful when we say that. I don't think it is. I think right now it's a very isolated encounter.
According to the Centers for Disease Control, hantavirus is rare but highly fatal, with between 20 and 30 cases reported in the U.S. every year. So what are the symptoms?
When we get sick, we typically get the symptoms of any other virus. So it's very similar to the flu or COVID, where you get fevers, headache, muscle pain, GI symptoms like nausea and vomiting. What we worry more about with this virus is it can progress to what we call a cardiopulmonary syndrome.
The virus is spread by rodent droppings, urine and saliva, which are then breathed in by the victim. With Chicago often cited as one of the most rat-infested cities in the U.S., do we have to worry about the rats here?
We've never had a documented hantavirus case in the rats here in Chicago.
This most recent hantavirus cluster occurred on a cruise ship, possibly after some of the 150 people on board took a bird-watching excursion to this Argentine waste dump. We asked an infection prevention specialist if cruise ships are safe.
Cruise ships are especially challenging because you have a high volume of people in a very confined space. And there's a lot of surfaces, people are brushing up against each other.
But Angarone says the hantavirus situation on board that ship is not one Chicagoans should worry about.
This is extraordinarily uncommon or rare event. This is not the kind of the norm that we would expect.
He says what is important is that we're monitoring the situation and that we're learning from it as it unfolds. Back to you.